She's revealed she has Parkinson's disease. For more on this, I want to bring in neurologist Dr. Leah Kroll. Dr. Kroll, thank you for joining us. I'll start with the caveat that you don't personally treat Carly Simon, but this is an issue that a lot of people have heard about, have thought about, have questions about. And so we appreciate you being here to help us make sense of it as much as we can. So Carly Simon has said that she had arthritis in both knees and a hip, and then had several joint replacements. In terms of Parkinson's disease and how it manifests, are those common early symptoms?
Allison, this is a really interesting question, and the answer is both yes and no. So one of the cardinal symptoms of Parkinson's disease is rigidity. That can feel like pain, stiffness, difficulty moving the joints. It sounds and feels similar to arthritis for a lot of people, but I want to be clear, there's not actually a relationship between arthritis and Parkinson's disease, meaning having arthritis doesn't increase your risk, but both of those disease processes are increasingly common as we get older, and there is an overlap in those symptoms.
So data shows 1.1 million people in the United States have Parkinson's, and nearly 90,000 people are diagnosed with the disease every year. What are some of the warning signs or things people should try and look out for?
So the main symptoms of Parkinson's disease are going to be problems with movement and mobility. Specifically, the classical symptoms beyond rigidity, like we already mentioned, are bradykinesia. That's a medical term for a slowing down of your movement, and resting tremor. That's involuntary tremoring that happens when you're at rest. Often we describe it as a pill rolling tremor because it starts in the hands and sort of looks like this, like you're rolling a pill between your fingers. But the symptoms can be more far reaching than that. Other things to look out for: depression, constipation, loss of a sense of smell, difficulties with sleep, difficulties controlling your blood pressure. The list goes on because there's so many different ways this can look depending on your individual case.
Talk to us about prevention. We know there is no cure yet for Parkinson's, but there are also promising treatments, right? In terms of prevention and possible treatments, what are those?
So it's not a curable disease like most of our neurodegenerative diseases, but we do have good treatments that help make the symptoms more manageable. The mainstays are going to be medications to increase the ease of your movements and your mobility. And also certain patients may be candidates for particular surgical therapies, things like deep brain stimulation or focused ultrasound. All patients really benefit from physical therapy, exercise, speech therapy, occupational therapy, mindfulness, meditation, support groups. All of that plays a role. And in terms of prevention, exercise, and a healthy diet.
And there are always doctors like you. If you have questions, concerns about yourself or your loved one, somebody that you can reach out to, a medical professional, for more questions. Dr. Leah Kroll, thank you so much. We appreciate your insights and time tonight.
Thank you.